Hi, everyone. My name is Helen Adioson. I'm CEO and co-founder of CareAcademy. If you are here for the COVID-19 Roundtable, the weekly Roundtable, you are in the right place. We are going to be talking to special guests Sheila Davis and Tim Burgers, and getting a special update from Dr. Maduri Reddy. So if you're here for the Roundtable, you're in the right place. Just give us 1 minute, and we'll let everyone kind of trickle in, get their coffee cups, and settle in for the Roundtable. Thank you so much for joining us, and we'll begin in just about a minute. All right, let's get started. Hello, everyone. Welcome to the CareAcademy COVID-19 Roundtable. My name is Helen Adioson. We're joined by some special guests. This is your time as home care agencies, as home health agencies, as direct care workers to ask questions and also give advice to other folks in the industry. And today we're joined by some very special guests. I'm really excited to have Sheila and Tim, and of course Maduri, joining us here to answer your questions. And I'll let everyone kind of start getting settled in. You made it through the week. Happy Passover, happy Good Friday to those folks who are out and observant. I know that this is not the same as Easters and Passovers in the past, but I hope that you all get to celebrate in some way. As we surely will. I'll be making myself a chicken and a turkey. So, but in the interest of making sure that we answer as many of your questions, if you haven't used Zoom, just a quick orientation. There's a control panel down at the bottom, and there is a pretty simple interface just to chat, raise your hand, or ask questions. Many of the questions that we're going to be answering today will come from some of the advice and the questions people have already posed as they were signing up, but we'll also be taking some of the questions live as well, especially some of the advice. And occasionally I'll be also asking for you to partake in our poll as well. So to click the Q&A to ask any of your questions, and we'll do the best that we can. And just a quick rundown of who we are. We are CareAcademy. We're the #1 provider of online training. We're specifically designed for mobile and mobile first. We offer record portability or portable records. That means a caregiver who has classes from one agency can port them on over to the next, saving everyone time and money, and that's very important, especially in these days. We have 160 hours of training that is accredited for private duty home care, and home health. Our online dashboard that allows for employers to see at a bird's eye view how their direct care workers are doing in each of those classes towards compliance especially. Customer support, not only for you, but also for your direct care workers, and that also enables them to complete their classes. And of course, API integrations, quite notably with AlayaCare and ClearCare, as ways to enable your home care agency to better integrate your information about your direct care workers. So that's just a short tidbit on who we are. So as we're getting set up, submit your questions and responses below. If you have any questions, if you have any shout outs, thank you so much. Brandy just posted a shout out to Bianca and Luis as #1 in their book. I really appreciate that, and I'm sure Bianca and Luis would appreciate that as well. Thank you so much, Brandy, Cowley, to letting us know that you enjoy our customer support. So if you have any responses, just like Brandy, feel free to post those as well. So let's get into it. So Dr. Maduri Reddy is my co-founder and the Chief Medical Officer of CareAcademy. She's a specialist in internal medicine and geriatric medicine and holds appointments at Harvard Medical School and Hebrew Senior Life. For years, she's seen firsthand the struggles that families and caregivers go through while caring for older adults. Dr. Reddy has published several research papers in prestigious medical journals, book chapters, and also a book for families and caregivers. Dr. Reddy Maduri, can you please provide us with the update, and then just a quick bio, a set of bios. So Tim Bergers is the Associate Director of Home Care Alliance in Massachusetts. Say hi, Tim. And so his areas of expertise include HR management, member communications, regulatory analysis, Medicare and Medicaid policy, private care management issues, and member services. And then
hi there, I had myself muted for a second.
There we go. There we go. Just to make sure your mic is working too, so that's awesome.
Yeah.
And Sheila Davis. Sheila Davis, CHCE and COS-C, is the Executive Senior Vice President of Area Operations of Always Best Care Senior Services. Sheila is a healthcare professional with over 32 years of executive leadership experience, with solid knowledge of healthcare operations and comprehensive nursing care procedures. Sheila is active with both NAHC or NAHC and the HCAOA, and has most recently been appointed to the HCAOA Medical Advisory Council. Say hi, Sheila.
Good morning, everybody, and thank you for having me.
Fantastic. Thank you so much for joining us, Sheila. And so now, if we just go into our weekly COVID-19 health update. So Dr. Reddy, I'm going to go ahead and give you the mic, just so you can share the latest updates for folks who are attending this week.
Sure. So I'll just start with the background briefly about this virus. So this is a new coronavirus that began from animal to human spread in China at the end of December 2019 and mutated, and now human to human or community spread is quite common, and the virus is very contagious, probably 2 times more contagious than influenza. And I will preface by saying that this is an evolving situation. I, like everybody else, am following CDC guidelines and any WHO guidelines. So I do speak with humility because this is evolving continuously, weekly, if not daily. I'm going to summarize a little about personal protective equipment, PPE, because I've noticed that most of the questions directed towards me have something to do with masks or gowns or anything else. So I will say that, you know, protecting our frontline home care workers, direct care workers, and other healthcare workers is obviously of utmost importance. So they will be there to take care of everybody else. A spike in the coronavirus cases is going to move from acute care hospitals, where we're concerned about a surge, of course. It's already moved into long-term care facilities and finally at home. So we'll be seeing more and more patients in long-term care facilities and in the home. If we could, under normal conditions, we'd recommend, the CDC would recommend N95 masks, eye protection, and gloves and gowns, single use for everything, for every patient or person who has suspected or known COVID-19. For anybody that has any symptoms such as cough or fever, etc., they should call their own healthcare provider and self-isolate until given further directions. Probably for healthcare providers, direct care workers, the self-isolation will probably be up to 14 days. So in a situation like this, the CDC a couple of weeks ago provided guidelines for 3 situations. It was really delineated very nicely about a standard situation where there's plenty of N95 and other PPE PPE available, a second scenario where there are no N95 masks and limited medical or surgical masks available, which is essentially the case in a lot of places now. And finally, a third situation where there are no medical masks or N95 masks available. So I had said in the situation where there's plenty of N95s around that healthcare providers and home care workers, including home care workers, would be using them all the time, but that is not the situation right now. So so the N95 should be reserved only for healthcare professionals dealing with aerosol generating procedures, and that includes ventilation, CPAP, tracheostomies, et cetera. So most of the times, direct care workers will not need to wear an N95 mask. They should wear a gown, gloves, and eye protection when possible. Use the best gown they can find or that is available, which may not be the case. There are also instructions on the CDC site about how to reuse masks and gowns. Again, under normal conditions, we would not be reusing them. Now that in many cases you do have to reuse them, you have to be very careful about how to fold them, not touch the front, and keep them in a breathable or paper bag. The other thing that has come out actually in the last few days is that the CDC has encouraged the public to wear homemade masks, and you can find how to make these masks online anywhere. I will say that the homemade masks are not meant to protect the wearer. They are meant to help prevent the spread of the virus in public if you can't social distance. So I think that I'll just stop there and I'll wait for any questions that come up during the webinar and answer at the time.
Fantastic. Well, thank you so much, Madhuri. I think we do have actually a couple questions, if you don't mind. So, Madhuri, question comes from Sean Lynch. How are companies handling it when one of their clients exhibits symptoms or are confined to because of the virus? What do you do when one caregiver is exposed to someone who has been confirmed but not exhibiting symptoms themselves?
So what the CDC says is that for anyone who has been in close contact with a person with known or suspected COVID-19, that they should self-isolate and call their healthcare provider. How you define close contact is not exactly clear, but it probably means being within 6 feet of a person who has known or suspected COVID-19 for, again, extended period of time. That probably means 20 minutes or so, or has had exposure to aerosols, like being coughed or spit on or something of a person with known or infected COVID-19. So then the caregiver, if that has happened, would have to self-isolate and call their healthcare provider.
Okay, fantastic. And then just one quick question, and then we'll move on and definitely make sure that we're asking questions that are maybe even health related to and positioning them for Madhuri. A question that has come in regards N95 masks. So what is required for fitting an N95? Could you elaborate on that, Madhuri? Yeah.
So I'm going to restate that N95s need to be saved for healthcare workers who are doing aerosol generating procedures only. That is according to the CDC. So that is going to be very limited for home care workers. In terms of fitting for an N95, OSHA has that clearly on their website, and you really need to have a fitting procedure and someone who's trained in fitting available at your site to be able to do that. So I'm not really anticipating that that will be something that now or in the very near future, many home care agencies will be able to do.
Yes, thank you so much, Madhuri. We really appreciate that too. So keep your questions coming, and I'll sort of change up as often as we can questions for all of our panelists as well. So with that being said, Jen, if you don't mind proceeding to the next slide. So we have a poll, and you all are right now part of our experiment, and all the folks who are probably on this. It's working. Perfect. So our poll question right now, our poll questions, how many caregivers do you currently have at your agency? We just want to get a sense of sort of what you all are where all of you are in terms of your shape and scale and time, and what is your biggest concern right now? Is it clients that are canceling care, so financial concerns, clients that are canceling care around becoming ill, caregivers not being able to work in childcare, or our caregivers are not able to work, so come out sick or family sick with suspected confirmed COVID-19, not having enough caregivers to staff current needs, and proper care instructions for treating COVID-19 positive clients and patients. So how large is your agency, and what is your current size, and what is your biggest concern right now? So as we're getting folks to answer those questions, you can go ahead and just answer those poll questions. It should have popped up right there. You can click on that and respond back inside the poll. So I noticed some folks are probably chatting it in. So a poll should have popped up on your screen, and you can answer it from that poll question, just so you can vote on that. And we'll see those responses as we're going into our roundtable. So I'll ask our panelists to unmute if they're not already unmuted. And Tim, the first question is for you. So this question comes from Gail Lohman, and she wants to know, I know we're now designated as an essential, and therefore we don't have the sick leave and FCRA obligations, but I understand this is being challenged. What do your experts recommend as best practices moving forward? Should we pay these obligations even though right now it's not required? What do you say to that, Tim?
Well, my recommendation would be, if you can at all afford to do it, offer your workers that extended sick leave option. It has been, I think, pretty well clarified that home health workers are exempted from that. And they're considered essential workers, so you don't necessarily have to, but if you can afford it, it's a great way to show that your workers, that you support them and are there to make sure that their safety comes first. And also something to think about is that there are a lot of financial programs and grants coming out from the federal government that would reimburse you for some of those costs. So it's not, it wouldn't be an entirely out of your pocket cost to cover that extended sick leave for these workers. You'd get reimbursed for a lot of that. So keep that in mind. But for the most part, home health workers are considered essential workers and you're not required to cover that extended sick leave.
Thank you so much for that. If you have any follow-up questions or responses or clarifying questions, by all means, make sure that you are posting that in the chat and in the Q&A as well, and we'll try to make sure that we field those. Sheila, the next question is for you. As a home care service provider, how do we, give me 1 second, just have a little bit of, here we go. How do we protect our caregivers and support them when they go into a senior's home? What has been your recommendation to folks within your franchise system, and what would be your recommendation overall?
So exactly what we've been telling our franchise system as well as our recommendations is, number one is to always follow those CDC guidelines and the WHO guidelines. You should have a proper screening tool in place for your caregivers every day, as well as a screening tool for those clients' homes that they're going into. So be sure to ask, those questions. And I know that not only the clients and the caregivers are getting, they're getting overwhelmed with these continuous questions. Have you traveled outside the country? Do you have a fever? Do you have any signs and symptoms? But it's there for their protection. So it's having that screening tool in place for both the caregivers and the clients before there's any entrance into the home. And then second of all, it's really a three-part scenario. Second of all is to instruct those caregivers, whether it's clinicians or if it's just a strictly caregiver or homemaker, is to ensure that when they're providing the care to that client, to have that distancing as much as possible, unless it's truly hands-on care of wound care or something that you have to be right over the client. Try and utilize that social distancing within the home. A lot of our providers are non-medical providers, so we're doing meal prep and light housekeeping and assistance. You still can keep that social distancing with the home of that 6 feet or more. So, trying to limit that space. And then the third part of that is to, even though it may not be mandated in a lot of areas and it's only recommended, but if you do have the supplies available, to encourage both the caregivers and the clients to wear that PPE, whether it's just a simple mask because it's protecting us from each other, to wear those masks, to wear gloves when you're doing any type of care whatsoever. And I think that's just good precautionary care that we also need to be doing in our own homes. As the CDC has released, this virus not only is airborne in droplets, but it can live on plastic, it can live on cardboard. So it may be even things that are coming in and out of a client's home that they're not necessarily familiar that that's how it can spread. So by wearing gloves, continuous hand washing, and doing it on both of the caregiver side as well as the client side. I think that's how we're not only going to protect our clients, but we're going to protect our caregivers, is just continually reinforcing what we should have always been doing. And I'm sure the doctor can agree here, is practicing those good universal precautions. I think that's one of the things that has really been an eye opener for everybody in our franchise system. Is they've heard me for so many years preach about universal precautions and practicing such good guidelines, but this really is an instance that that really could have prevented a lot of this had we all been doing it out there. So I think it's kind of that 3-point system of asking those questions valid on both sides, the client side and the caregiver side, then making sure that they even practice that social distancing while in the home. And then third of all, using that PPE equipment that is available to them. And if it's not available to them, as the doctor pointed out earlier, go to your CDC site and look at those recommendations. There is even some recommendations that if you don't have PPE equipment available to you, what are some alternatives that you can utilize? I have even seen that it's been recommended, that if gowns are not available, that you can use 55-gallon or 30-gallon trash bags and for makeshift gowns, the homemade mask. So even though we may not readily have what we consider in our industry proper PPE available, there are some alternative solutions that the CDC has recommended to us that we can pass along to caregivers and clients in their homes to utilize.
Fantastic. Thank you so much, Sheila. And so I see a couple comments and questions. If you don't mind putting some of those questions and comments definitely into Q&As if you want our panelists to answer those. And Sheila, thank you so much for the reminder that some of the basics apply here as well in our COVID environment. And so a lot of this is making sure that we're doing some of the sort of basic tenets of infection control. Someone asked, and maybe I would actually love to see if we can answer this. And I'd actually first like to have Gail Loebman, if we could have maybe Gail Loebman unmuted and try that out, Jen, if you don't mind, just to get some context around this. But Gail Loebman's asking, do you recommend changing clothes after each shift? So Gail, you're now unmuted. Can you tell us a little bit more about your question?
For a caregiver that is going between 2 clients or 3 clients during the day, should they be changing their outfits, changing their shoes? What is the best practice for going between clients?
So there is some evidence that the virus can live on objects for 2 or 3 days. So I will tell you in terms of a facility, for patients that are not known or suspected to have COVID, we don't change clothes or change gowns or anything between patients. Now, if it's a known or suspected person with COVID, then it would certainly put on a gown or protective gear before you go in. In terms of coming home afterwards, oh, and you asked about shoes too. Yeah, I would definitely not be walking around someone's house with the same shoes on. Certainly when I come home from work, I take my shoes off actually downstairs in the basement. I get changed. I take a shower and wash my hair before I interact with anybody else. But I don't think that's necessary between all patients if they're not known or suspected.
Okay, thank you.
Thank you so much, Gail. Really appreciate it. Thank you for answering and asking and answering that live, Maduri. Really appreciate it. So the next question that I'm going to go ahead and pull out, just so we can make sure we get to these. So Sheila, if companies are going to apply for the PPP loan, they should contact their bank ASAP. They should also be sure to get a list and have files of all required documents. This comes from Tina Moore as advice, but would you provide any kind of guidance that you all are, communicating around the PPP loan?
Sure. So first of all, an individual agency should consult their accountant or their financial and tax advisor to see, what is the best aspect for themselves. But I will say that not only within our organization, but because I sit on so many of the national boards and interacting with a lot of other agencies and franchise systems as well, this is a new forgivable loan program. And so, my personal advice is it's better to be safe than sorry. So I know that there has already been a lot of agencies who have been approved for their PPP loan. It seems like they are processing them quite quickly. Of course, it's depending on the size of the financial institution that you're going through, but I have seen a lot of agencies already be approved for these loans. And it's something that there's some loan forgiveness if you're utilizing it for payroll, or as you mentioned before, maybe some voluntary sick leave, or if you have to isolate a client, or not isolate a client, isolate a caregiver for a specific time because of exposure. And the other thing about it is you can't get it if you don't try. So what if you need it and you didn't try for it? Then you're going to be in a worse scenario. So my advice is to go ahead and apply for these loans. You can always be granted the loan and the money can sit in your account for the 8 weeks. And if you don't need it, then you simply return it and pay it back. But I think we still do not know the unknown of this virus and what the future holds for us. As the doctor stated a minute ago, we haven't seen it hit facilities and homes, and actually the general population I don't think has been hit to the peak as we're expecting it. So I don't really think that agencies know the financial burden that they may incur. So my advice would be is to contact your financial advisor, go ahead and apply for the loan. Hopefully you'll be approved. I haven't seen anyone so far that I've talked to that has actually applied for it and been denied yet. They've been asking some additional information, and once that information has been supplied, it seems like the majority of them are being granted and the money is already starting to hit people's accounts. Simply, if you don't need it, then don't utilize it and return the money in 8 weeks, but at least you've got it in case that unknown hits us in the next couple of weeks and you're hit with some unforeseen conditions or situations that you do need the money.
Fantastic. Thank you so much, and that's great guidance. On that note, would love to know more, Sheila, about what you all are communicating. We had a question come up earlier around sending out COVID policy to clients. How are you sort of streamlining and thinking around sending your policy out to clients? And someone also had just and just streamlining some of these two, Mitchell Opalski, I'm sorry, Mitchell, if I butchered your last name, just asking a question around, you know, sending non-medical home care agencies attending to COVID-19 patients and folks who have tested positive. What are your thoughts around that, and also policies and sending out policies to clients?
So I'm going to answer the first part. On the policy part, we did devise a very simple 2-page flyer that kind of simplified our policy on treating either non-COVID patients or COVID patients, because we are treating both. And we just simply distributed that to them. It was more of an informal policy to let them know what steps we were taking to protect not only our caregivers, but to protect them as clients and patients as well. It was very, very well received by our clients, and I think it made them feel more comfortable knowing the exact steps that we were taking. I have visited with a lot of agencies that said, you know, we hate to send out that information to them because we think it's going to scare them away and all of a sudden they're not going to want us in the home. I understand that, but as you know, just from a personal standpoint too, take the flip side of that and understand if someone provided you with what they are doing to protect you, it actually makes you feel that more confident and comfortable for those caregivers to be coming into your home. So I would try and make it as simplistic as possible, but to let those clients and patients know what you are doing for them to protect them, and that you do have policies in place and that you are following CDC and WHO guidelines. What is your proper universal precautions? What are you telling your caregivers to do? I think it affords more of a comfortable situation to the clients to know that you have those policies in place, rather than you're just, you know, going with it on the fly, which we do know that there's a lot of agencies out there doing that. So I think anything we can afford to the clientele to make them feel more comfortable within their homes, that they are being protected, I think it is a positive impact, and we have seen that positive impact. The second part of your question on caring for a person who is symptomatic or has tested positive, yes, our agency, many of our agencies and franchises are caring for those clients in their home. And there's several really considerations that you need to take as an agency to determine whether you are going to take those clients to begin with. You know, there's several legal and business practices that you need to really first consider. First, you need to look into your existing policies and procedures. Look at your communicable policy to see if your policy and your governing board has even answered that question as to, are you able to take those clients, and do you have policies and procedures in place to take those clients? You should also look at your regulations that govern your agency to see if those issues had been addressed. If there's no if nothing prohibits you from taking that, then you need to determine whether the caregiver that's going to treat the client has the proper PPE protective equipment to care for that client and to protect that caregiver. You also need to determine whether the caregiver has the proper training in the use of that PPE equipment. I think that that's something that I have seen, is we can't just, you know, hand each caregiver a Ziploc bag with all this PPE equipment in it and assume that they know the proper way to utilize it. They have to be trained on the proper utilization of that equipment in order for it to be effective. You need to also examine your workers' compensation policy to determine if caregivers are, you know, able to care for those clients, if you're covered as an agency. And then finally, you need to determine whether any of the caregivers that you have working for you are even willing to care for those type of clients. Once you've done all of that, you know, if you're completely safe and you're ready to go with that, and you have your policies and procedures and you've checked with your state regulatory issues, then I think you need to consider, how are you going to go about assigning those caregivers? In our agencies and in our franchise system, we have taken the stance that if we have an active COVID client, or we even have a suspected COVID client that is symptomatic, we are assigning just a sole caregiver to care for that client, and that caregiver is not being allowed to go into any other clients' homes at this time. So I think that once you have established whether your agency is ready to take on clients, you have all the policies and procedures in place, you've done the proper training with your caregivers, you're satisfied that they know the proper utilization of the equipment, they know the proper utilization of universal precautions, then you need to decide how is it that you're going to go about the scheduling of those clients. And I would highly recommend, and again, that's something you need to take to your board and your governing body. But I think that if we can eliminate those caregivers going to care for any other clients, then I think it's going to be a better situation. So that is how we're handling it in our system.
Absolutely, and I appreciate that, because your feedback around just clarity and transparency, just in terms of the nature of this disease in this moment, if you don't already have policies and procedures, I think that we're still sort of in the midst of orienting ourselves, all of us, in lieu of how the situation is changing day to day. But I think taking the time now to be clear and messaging out to clients is definitely appreciated, and love that piece of advice of orienting your policy as soon as you can, and also providing guidance, right, especially around PPE and usage for your direct care workers. And so there's another. Go ahead, Sheila.
I was just going to say, and just to, add one other thing, Helen, is that, even if you do have a communicable disease policy in place, you need to review that policy and ensure that it does cover such things as a pandemic such as COVID-19. A lot of our policies are very simplistic and may not cover that aspect or that nature of it. And then also there are so many policies and procedures that have come out from, whether it's CMS issued a whole new memorandum of policies yesterday that need to be implemented. And I know a lot of states are coming out with some temporary policies and procedures that need to be put in place. So, instead of just having to go back every single day, I know that, our key employees at our agencies and administrator and whoever is responsible for our policies and procedures don't really have enough time to just sit down and revamp policies and procedures every day. But you do need to have something in place that in your agency is adopting these temporary policies and procedures that are either being handed down from the CDC, the WHO, whether it's CMS, whether it's a federal regulating body or a state regulating body. Agencies really do need to take that into consideration, that they need to have something in place that states that they are accepting the responsibility of these temporary mandated policies and procedures, and they are putting them in place within their organizations. Because even though our number one concern right now is taking care of our clients, taking care of our patients, and taking care of our caregivers, we still have to be mindful as executives within the agency that we still are going to be held accountable to our federal and our state regulatory bodies. And at some point in time down the line, we are going to foresee and face those post audits and those surveys, and they are going to be looking at to how we handle these situations during this crisis, and if we followed proper policies and procedures. So even though that's one of the things that may not be on the forefront of our minds, it still has to be something that we are taking care of every day and ensuring that we're following and we have the proper policies and procedures in place in our agencies.
Fantastic. Thank you so much, Sheila. Yeah, go ahead, Tim.
Yeah, I'd just like to add that we are recommending that our member agencies put in place sort of a blanket emergency policy saying, these are our normal policies and procedures, but in case of an emergency situation, they might be superseded by guidelines from CDC or whatever, or CMS, so that you don't have time to review every single policy and procedure and tweak it just for this emergency. So if you'd have sort of a blanket statement in your policies and procedures, that might cover it as well.
And that's exactly what we've done as well, Tim. So great, thank you for adding that.
Fantastic. Thank you so much for adding color on that, Sheila and Tim. I really appreciate that. So a question that we're going to go ahead and answer live from Nora Edge. And so if we could just make sure that we have Nora on as well and unmuted. So Nora asked, are caregivers required to wear gowns at all times? If we are limited on our supply of gowns, should we be instructing them to follow CDC directions to use trash bags? Nora, did I get that right?
Yes, I do want to clarify, since I posted that question, Dr. Reddy had clarified that the CDC was recommending putting on gowns if we are working with a suspected or confirmed case of COVID. So I did find that helped clarify that a little, but I am wondering about the kind of MacGyvered PPE directions that we're getting. You know, I know, for instance, when I've talked about trash bags with my caregivers, that is not, that doesn't really go far in making them feel safer. So I was just curious.
I can imagine. Thank you, Nora, for your question. Maduri, would you like to take that? If you unmute, there we go.
So on the CDC website, it says wear the best gowns when available. I believe that's kind of the wording similar to that they use. So if you have medical gowns, disposable gowns available, then that would certainly be the best thing. And I would only use something else if, as an absolute last resort, if there was absolutely nothing available.
So Maduri, it sounds like you're saying that this sort of part of the framework has kind of been left vague there, is sort of an opening for an interpretation of whatever can best meet the need. How would you suggest that Nora maybe start off her Monday meeting with her caregivers, or, you know, talking to her caregivers who may feel uncomfortable around that?
Well, I think first of all, you need to know which of your clients have known or suspected COVID. And it's, you know, in terms of saving your personal protective equipment, save it for the caregivers who are taking care of those specific clients. And also limit the caregivers who see suspected or known COVID patients to caregivers that do not have any other chronic medical illness and who aren't at high risk, and perhaps even those that are pregnant. And maybe, we don't know yet, but the thinking is that people who have had coronavirus may be immune to coronavirus for the next little while, even though we don't have a test to test the serology yet. So again, caregivers who have had COVID-19 might be a good match for patients who've had COVID-19. So there are other options to try and minimize the caregivers who require the gown and other PPE. You wouldn't have to use it for every single caregiver. So the reason I'm hedging on the trash bags is, yes, if you have absolutely nothing else, you got to do what you have to do. But try and kind of wisely use the PPE that you have already.
Fantastic. So it sounds like, you know, in these days, in these times, the lag and shortage, the recommendation is to first allocate what you have, actual PPE wisely, and then do as you must in these times, or do your best. I will also add on top of that, and this is just advice that's carried over week to week as we're all dealing with this disease, is to document whenever possible. I think that you can't go wrong in terms of documenting why you're making choices and how you're choosing to allocate and so on and so forth. So that definitely applies in this time if you're, to your words, Nora, thinking about sort of MacGyvered PPE as well. Does that help, Nora?
It does help. I really appreciate you taking the time. Thank you.
Thank you so much. So on to the next question, and you know, if anything, I have a question, and please, you know, all feel free to jump in. I have a question from Janita Cooper. If someone tests positive and is quarantined for 14 days, is a second test recommended before they can return back to normal life? I'd love for Maduri, Sheila, Tim, what are your thoughts and what are your recommendations, or what have you been hearing also from your members as well? Let's start with Maduri first. Maybe I'll do that, and then that way.
Could you repeat the question? I heard the
Sure.
return to normal life part, but I didn't hear the first part.
Oh, I know, yeah. So if someone tests positive and is quarantined for 14 days, is a second test recommended before they basically can go back out,
Oh,
right?
yeah.
Come to, yeah.
So if there were enough tests available, we would be testing widely. But the issue is that there are not enough tests available yet. So every district or state has recommendations for how they're going to use their testing. So certainly I do not believe that there are instances where second testing is recommended.
Mm.
And there's, just to add to that, I mean, there's so much for all of us to keep up on, but there is actually a recommendation on the CDC site that actually is, if COVID testing is available, then of course, resolution of fever without the use of fever-reducing medications, improvement of respiratory systems if they had a cough or shortness of breath, and then a second negative test result from the second test. But then, there's guidance also because, as the doctor pointed out, we already know there's a limited number of tests within the United States, and we don't have enough tests even to test those that are being considered positive right now. So kind of the recommendation on the testing, if it's not available, is at least 3 days or 72 hours have passed since the recovery. And recovery is defined as resolution of fever without the use of any fever-reducing medications, no cough, no shortness of breath, no cold-like symptoms. And I think that that's a very broad spectrum of what cold-like symptoms could be interpreted at. And then at least 7 days have passed since the symptoms first appeared. So that is actually on the CDC website. There's a section there for returning to work, and it actually lays out if a test is available and if a test is not available.
I actually, that's a good point, Sheila. And in my summary slide, I'll share a link to that.
Mm-hmm.
Fantastic. That's great and really appreciate it. Well, so this question, I'm just taking a look also where questions are coming at and seeing what our capacity right now to answer as many questions as possible. I think this was a follow-up from Karen Upstill. What about telehealth and or remote care sensor monitor devices triaging clients before a home visit? Medicare CMS they're waiving many regulations and reimbursements for telehealth access, symptom checkers, and remote care. Do you all have a sense of that? I think that's maybe a general question about how remote care and telehealth is sort of being basically being utilized within home care and home health. If you all have any sort of insights into that.
I can go, I guess. I know that many of our member agencies here in Massachusetts are transitioning to using quite a lot of telehealth to replace some of the in-person visits that they would normally give to their patients. Medicare allows it, but doesn't consider a telehealth interaction a visit. So agencies might get in trouble or lose Medicare reimbursement if they substitute too many visits using telehealth. So that's something to consider. In Massachusetts, our Medicaid program does recognize the use of telehealth to replace in-person visits. And in fact, they're allowing agencies to use strictly telephonic check-in to replace visits, so long as there is actually a clinical assessment skill being provided during that telephonic check-in. And they're reimbursing those interactions at the regular visit rate. So it is definitely a good idea to use telehealth services whenever possible to limit the in-person contact. Of course, there are some instances where that's not possible. I can't imagine an instance where a home health aide would be able to do a telephonic visit for a bed bath or whatever.
Right, exactly.
So there are limitations, but agencies certainly should consider switching to telehealth whenever possible.
Mm-hmm. Thank you so much, Tim. Any other thoughts, Sheila or Maduri?
I would just reiterate what Tim just said. I mean, we are utilizing some telehealth just as well. You just, of course, as you mentioned before, I think, Helen, you mentioned it, it's documentation, 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 because that's what CMS is especially going to come back and look at. And to making sure that there is some type of skilled, if you're going to be charging for it. We are putting a lot of telehealth, just check-in calls in place. You know, things that maybe routinely could just be done over the phone, whether it's vital signs or some of that. We're putting some telehealth monitors in the home. So whatever we can do to try and limit that exposure, I think telehealth is going to be something that is going to have to be widely used, because when this you know, pandemic really hits its peak, I don't know if we're going to have enough healthcare workers to see everybody, because the hospitals are going to be overflowing. We've already heard from many, many hospitals as well as CMS that, you know, home care is going to be playing a very, very vital part when this thing does peak, because in order to free up hospital beds for those that really do need intensive care, we're going to have to start discharging some people that may still be symptomatic and still have some type of the COVID virus. So I think home care is going to be playing a very, very important part, and that agencies need to be planning to what they can put in place to, you know, telehealth wise, to limit the exposure of their own caregivers and their own clinicians, as well as protect the family and the family members of those patients.
Absolutely. Actually, on that note, we have a question from Sarah Martinez, and we're going to go ahead and see if we can answer that live with Sarah. I'll posit the question, and Sarah Martinez, if you are on, you can clarify. So for tested positive patients who have been on isolation, how long after should isolation be continued? So for example, we have a patient in hospital tested positive April 2nd, being discharged possibly tomorrow. What precautions and how long do we take? Sarah, did I state that correctly, or do you want to add anything else onto that? I don't know if Sarah's able to answer on, but I don't know if you want to help sort of answer some of that question, and maybe she's listening in.
So first of all, I would hope that the discharging institution would give you some guidance on what to do there. So that is the first thing to check on. And secondly, CDC recommends self-quarantining for, as we've said many times, 14 days after being exposed or having the virus. So I guess it depends when they tested positive, but I guess it depends when the thought is that that individual actually contracted coronavirus, because it could have been asymptomatic for several days. So I really would depend on the facility to give you further instructions going forward with that.
Okay, and Sarah, Sarah even said for clarification, nothing has been given for now, so I don't think she may have received any sort of instructions. But they said they maybe had
instructions. I would say.
Yeah, absolutely. All right. So just in terms of you know, our last sort of final questions, and before we get into takeaways, you know, in terms of your recommendations for PPE, reusing masks, a question came in from Jane Krause. Sheila, Tim, Maduri, would love to get your insights on this. Would like to understand what other private duty agencies are doing in terms of the unavailability of PPE. I think that goes to our earlier questions. Are you recommending the reusage of masks? So I think that there are CDC, WHO guidelines, and then there's also sort of this understanding of what is made available. How are you speaking to that specifically in terms of policy and practice, and what are your recommendations around that?
So, you know, again, as Dr. Reddy pointed out, we are trying our very, very best to follow CDC guidelines. you know, we have been fortunate that we've been able to obtain quite a few PPE supplies. So, you know, we're not using the N95s because except for those clients that may be 100% positively active, we're using, you know, regular masks. And so we're not reutilizing them at this time, except for we do have some caregivers who have some allergies. And so they are using some of the homemade masks. And then of course, it's just following the best recommended procedures of bleaching those masks every single night, washing them appropriately. You know, as far as the regular PPE mask, I know there's some good recommendations on the CDC, and Dr. Reddy can probably give you more guidance after I finish, but you know, there are some specific guidance on if you are having to reuse masks, the do's and the don'ts. You know, you don't want to get those masks wet. You don't want to spray them down with disinfectant or anything, because once you make those masks, that the materials, you make them porous by getting them wet, then they're not as effective anymore. So I think that agencies really have to do their research on if that's going to be something that they are going to have to do. Secondly, another thing that we have done is we've researched, you know, on the utilization and how to store PPE materials. And for caregivers who have, you know, isolated clients that maybe we are having to reutilize in some places, they're actually taking off the PPE equipment that is for that patient, and they're leaving it right outside in whether it's, you know, an entry hallway or something right into that client's home, that when they return the next day, they can utilize the same equipment and it's not being cross-contaminated with any other clients. It's only being used in that one client home to help protect that client. And then third of all, I would say, you know, to anyone on this call, to be leery when you're, you know, making orders for PPE. There's a lot of advantageous people that are trying to take advantage of agencies out there, whether it's by price gouging or just actually there's some fake sellers out there. I will say that I am on the medical advisory board of the HCAOA. We do have a free listing on the HCAOA website of some vetted vendors that we know that actually have PPE equipment in stock at this time. So if people are looking for PPE, there's that site on the HCAOA, as well as the National Association of Home Care. The NAHC site also has a listing of valid PPE vendors out there. So, you know, be careful is all I have to say to everybody out there. I don't want anybody in this time of need to be taken advantage of, but I do understand the need of getting that equipment. And so there are those two resources as well out there.
So
That's fantastic.
yeah,
Oh,
that's
sorry, go
very
ahead, Mary.
helpful. That's extremely helpful, absolutely. And I'm going to also share a link at the end to the CDC site recommendations for coping with PPE supply challenges. And as I briefly mentioned initially, if you have a limited supply of surgical masks, no N95, the CDC recommends that you can extend the use of the face mask. So the direct care worker may need to use the same face mask when caring for different care recipients. They need to be removed after each encounter. And the face masks with the elastic ear hooks are more suitable for reuse than those with the ties. Between uses, you have to store the folded mask in a clean, sealable paper bag or breathable container. So the face mask should be removed and discarded if soiled, damaged, or hard to breathe through. And I know soiled is sort of subjective. And prioritize face masks for selected activities. And the workers should try and stay 6 feet away from the patient anyway. And a patient with, or the client with known or suspected COVID should wear a mask as well when possible.
Fantastic. Well, with that being said, we're going to go ahead and wrap up as we do every week with our takeaways by our panelists. We've got a panel of very wise folks in the midst of all of this, and so I want to share their takeaways. Maduri, go ahead and go at it. What are your takeaways for this week?
So these are really links for you to get further information and see if there's any updates. I know someone had asked the question, how can you stay up to date with updates without spending 6 hours a day on the computer? I saw that question. So these should be these are the most up-to-date CDC links. So one is, as I mentioned, CDC recommendations for PPE are different if in a crisis situation. Number two, consider allocation of staffing, and I have a link for that. Third is precautions in the home for home health care workers, and there's 2 links. And the CDC sort of has a definition for home health care. It says anybody who has direct contact with patients. So I'm thinking that would include all types of home direct care workers. And finally, return to work policy and restrictions. The CDC has 2 links for that. This one is for healthcare workers, which I would think home care workers would fall into. And then they have a separate link, which came out a couple of days ago, for other essential workers. And that one says they can return to work within 7 to 14 days. But this one, I believe, is 14 days after first symptom.
Yeah. And then we noted that there are, Dr. Reddy's providing a lot of links. So what we're going to do on our site, the webinar is always recorded. We provide the recording of the webinars, and we'll do something that I think may help. And I'm saying this in real time, so our team is adjusting because we got to do this because I'm the CEO. But we will also provide this deck as a PDF download on the bottom of that recording as well. So, and as well as the email that goes out right after the webinar. So we'll provide this in many forms. I know, Shelby, you're asking about that. We'll make sure we provide these links and these decks. And it's, yes, there will be takeaways. Absolutely, absolutely. And then go ahead, Sheila, let us know your takeaways.
Okay, again, just want to reiterate what Tim and I talked about a little bit earlier is every agency needs to have an interim procedure change in policy form. Like I said, CMS issued temporary regulatory waivers and new rules. So, you know, do an interim procedure change, a form, and then you need to have documentation that your staff does acknowledge those policies and procedures that you are doing during that emergency situation. And I'm going to be happy. I will actually send Helen a sample copy of what an interim policy and procedure change and acknowledgement form can be, and you can attach that to the email when it goes out. Also, I just want everyone to know, and I thought this was very also interesting for me personally, is everybody needs to visit the EPA site. There are only certain approved disinfectants that actually are combating the COVID-19. So, you know, even as we're cleaning our home and we've been to, you know, the Walmarts and Targets and Costco's and we've seen all the cleaning supplies flying off the shelves, there are only a limited number of disinfectants that actually disinfect against COVID-19. So we want to make sure that we are promoting those cleaning agents, you know, not only to maybe our personal selves, but also to our caregivers and also to our clients to make sure that they are disinfecting their homes with the proper cleaning agents. And then the last takeaway is I don't know if any of you have been following, but there is a waiver of liability form that you can have your client sign regarding COVID-19. So I would encourage everybody to reach out to whoever their legal advisor is and inquire about having a client waiver of liability on hand and issued. We all know that the ambulance chasers are going to come out of the woodwork when this thing is over with, and we all want to make sure that we're providing the utmost protection to our agencies. We don't want to see anyone, you know, end up in a legal battle afterwards. Not saying that anyone is doing anything that even would remotely consider that. That's just the nature of the time that we live in. So I would highly encourage everyone to reach out to whoever their legal counsel is and implement a client waiver of liability as soon as possible.
Fantastic. Thank you so much, Sheila. That was great. And Tim, last but not least, what are your takeaways for this week?
Well, as we've seen, the situation is very fluid. New guidance is coming out every day, and even CDC has revised their guidance several times. And it's really hard to keep on top of it all. So make sure that you identify reliable sources and go back to those sources frequently to make sure that you're keeping up on the newest information. And ignore those questionable sources that might be trying to sell questionable questionable products in this time. Also, the Federal CARES Act and the Families First Coronavirus Response Act have a really rich range of financial supports available to all types of employers. Research those, take advantage of what is available. As Sheila said, better to get a loan and not need it than need a loan and have not applied for it because you thought you weren't going to need it, or you thought you might not qualify. So do your research and apply for anything that is available. And Sheila also mentioned this a couple of times, consult with your legal and financial experts. I'm not a lawyer, I don't pretend to be, and I don't think that you should rely on my advice in any of this. Talk to your own lawyer.
I agree.
Yes, and we'll say all of this are suggestions, opinions, and best practices, not necessarily legal or medical advice, but really appreciate all of our wise and very sage experts this week. Sheila, Tim, Maduri, thank you so much for all of your insights and your brilliant advice. I think that you've helped a lot of folks out today, and we'll make sure we provide these resources. Speaking of resources, so some of the additional resources available through CareAcademy include our updated COVID class. It is continually being updated. We've also included an N95 mask course as well. And so you can receive that certification at bit.ly/COVID-19 certification. As I mentioned earlier, these links will be provided via a download of this deck. And that is available on our website, whether you are a customer or not a customer of CareAcademy for your caregivers. So our class has been updated again. We are not only providing this COVID class, but we're always on a weekly basis, and a huge shout out to our team and our content team, continually updating, and Dr. Reddy as well, continually updating our COVID class. So our COVID-19, a guide for caregivers, is available for free on our website. And if you're a customer of CareAcademy, we're waiving our fees for additional users to that class through April 30th. So reach out to either our customer success team or our sales team, and we can help you get started. Again, thank you all so much. Thank you to all of our attendees for joining us today. We hope we can answer some of your questions. Your certificate will be, if someone asked this really quickly, but you can access that after completing the class on the website. So with that being said, thank you so much for all of your insights. Thank you so much for attending, and we will see you next week. Do we know who our next week is going to be, Jen? Do you have that available?
Yeah, next week we will be having Doug Pace from the Alzheimer's Association and Steve Smith from Cincinnati Insurance.
Fantastic. So look forward to that discussion from the Alzheimer's Association and from Steve and regarding insurance and sort of what to watch out for this time. Thank you so much, Sheila, Tim, Maduri. You've been wonderful. Really appreciate it, and we'll see you all next week.
Thanks, it's been fun.
Happy
Thank you so
Easter.
much. Happy Easter. Happy Easter. Happy Passover. Bye-bye. Bye, guys. Bye.